We know that obese patients can expect longer surgery times. Just getting through the fat layers takes more time. Obesity can often double the length of surgery. However, the longer the surgery proceeds, the longer the patient will need to be asleep and the more anesthesia is necessary. What many people don't realize, however, and that includes many of my clients with whom I've had this conversation, is that the anesthesiologist has a much more difficult situation on his or her hands for surgical patients who carry a lot of extra weight versus those patients of a healthy weight. It's not just a matter of, turning up the dial on an anesthesia machine, to let more air out. Obesity-related changes in anatomy have significant implications for obese patients requiring surgery and anesthesia. Finding an appropriate blood pressure cuff to fit a patient's arm and more difficulty in locating veins. Airway management presents special challenges because their airways tend to close when they're under a sedation. Obese patients need breathing tubes inserted more often, and getting a tube into their airways is more difficult. Necks are bigger, yes. Fat people have fat throats, so it's harder for anesthesiologists to see the vocal cords. Therefore, placement of a breathing tube may require special equipment such as video assistance. Airway obstruction due to obstructive sleep apnea can result in decreased airflow and oxygen in patients receiving even minimal amounts of sedation. Obesity can double the risk of serious airway issues such as emergency tracheostomy, cutting a hole in the front of the neck into the windpipe to deliver oxygen, admission to the ICU, and brain damage. All of the above complications are compounded by other underlying health problems many obese patients often have, including hypertension, heart disease, and of course diabetes. Finally, a heavy chest and abdomen also make it more difficult for a patient to take deep breaths after surgery, not only leaving one in a groggy, weakened state for a longer period, but also pneumonia is more likely to develop in areas of the lung that don't fully expand after surgery. So let's hear it for the anesthesiologists who must anticipate all these difficulties, prepare for them, and counsel obese patients regarding potential complications. If you are obese and contemplating any kind of surgery, help the anesthesiologist by losing some weight, and that will greatly help you get through surgery with fewer complications. And that's today's Fat Chat. See you next time.